Hi, I'm Dr. Pentyala, facial plastic surgeon and director of Dr. Pentyala's cosmetic clinics and aesthetic clinic based in Bangalore and Delhi-NCR. Today I'm going to talk in detail about what exactly is genoplasty and who are the ideal candidates to undergo a genoplasty. Well, genoplasty is nothing but a chin reshaping surgery, which you can call it as also chin cosmetic surgery or plastic surgery of the chin, which is usually done on males, females or even in transgenders who desire to have an excellent sculpted chin. Usually the genoplasty is indicated, if you can see here in the model, if a patient has a retrograde chin, you can do an osteotomy, you can get the chin forward. If a patient's chin is protruded, you can take it back. If the height of the chin is more, we can reduce the height. If the height is less, so we can increase the height as well. And sometimes there will be asymmetry of the chin, which means one side of the chin will be bigger than the other side. That also can be rectified. So almost 5 to 6 corrections that you can get forward, backward, upward, downward, and asymmetry also can be corrected. So this is purely done for the cosmetic reasons. And sometimes genoplasty is also done for the functional reasons, where patients have some bit of obstructive sleep apnea, where the patient has a difficulty in breathing because the retrograde chins, usually what happens is there is a chance of the tongue fall and there is a compromise in breathing as well. But mostly it is done for the, we do here for the cosmetic purposes. Coming to the procedure, exactly the procedure can be done under local anesthesia with IV sedation or general anesthesia. Well, the choice of anesthesia again depends on the patient and the doctor. Sometimes patient asks us to do under general anesthesia, but well, it can be done safely under local anesthesia with IV sedation as well. The time duration for this surgery is usually it takes around 90 minutes to 2 hours. It is done as a day care, and the procedure is done from intraorally, where the incision is placed in the intraoral, just beneath the lip, that is inside of the lip, and they expose the bone, do an osteotomy, and the bone can be moved forward, backward, or upward, downward, based on the individual requirements. Once the procedure is done, the patient will be having a couple of plates and screws, followed by the suturing will be done with intraoral suture with a resorbable suture, which means there is absolutely no need for the stitches to get removed. Coming to the post-op instructions, well, before I say that the patient can be discharged in the same day evening with a few post-op instructions such as sleep in the head elevated position. Do not do gymming, swimming or exercise, strenuous exercise for a week to 2 weeks. Mouth gargling is very important for the genoplasty since it is an intraoral procedure. The patient need to take an antibiotics, anti-inflammatory drugs and the swelling drugs for 5 to 6 days and sometimes up to 7 days as well. But the mouth gargling should be followed for at least 2 to 3 weeks, which means you need to keep your oral cavity very clean. Well, many people ask pain followed by genoplasty. Yes, definitely you would have a bit of discomfort following genoplasty, which can be maintained with post-op pain meds. Coming to the swelling, definitely since it is a bony procedure, you would have a swelling over the chin, sometimes beneath the chin as well, which is again as a temporary. Most of the swelling will resolve in a week to 2 weeks time. But for any individual to see the final outcome of the genoplasty, it could take around 6 months and sometimes it may go up to 9 to 12 months as well. Follow-ups is, coming to the follow-ups, absolutely, maybe after the procedure you can just see your surgeon 1 or 2 times after the genoplasty if you are from the same station. If you are from the outstation, absolutely there is no need to come personally and visit the surgeon. You can just speak to your surgeon about the progress of the post-surgery over the phone or video consultations. Sometimes coming to genoplasty, sometimes we combine the genoplasty in the same day when we do a rhinoplasty, because to give the excellent facial profile to the patient, because the nose and the chin are middle structures. So most of the if an individual is okay, it's always better you go your genoplasty, get your genoplasty done along with the same day when you go for your rhinoplasty. If there is a need, I mean to say, if you are going for a rhinoplasty, if your chin is retrograde or if your chin is protruded, or if you have a asymmetrical chin, or if you feel your chin, the vertical height of the chin is more or your height is less, definitely Genioplasty is one of the excellent procedure which complements the rhinoplasty. Thank you very much.